Good evening and welcome, everybody, to what is going to be a really exciting webinar, I'm sure, on the very important topic of birth trauma. It's something that I think affects, more horses than we sometimes think, and it's wonderful to have our experts here tonight to tell us more about this. And before I introduce our experts, I want to say hello also to my colleagues and fellow board members. So there's Nadine, who's been running the show for us, who's been organizing everything behind the scenes. And then there's, I can see Andres and I can see our honorary member, Paul Hubert. Lovely to see you here, Paul. And and yes, and welcome to you all from all over the world. It's lovely to have participants really from, from everywhere. After all, we are the World Breeding Federation. So let's bring the world to breeding and breeding to the world. And welcome to you all. It's now actually Nadine has reminded me that I need to remind you all, please, first of all, to keep yourself muted. And this helps with, the smooth running of the webinar because otherwise we can get interference. And please also, if you have not already done so, can you put your full names in your windows? And if you are representing a stud book, also the name of your stud book. This helps us. If you have any follow-on questions, we can then follow those up with you and can make sure that you get the contacts and the information you need. So really, really helpful to do that, please. First name, surname, and stud book if you're representing, if you're here for a stud book. And of course, we welcome all breeders, also those who are not just involved in one stud book. So that's all good. And now let me introduce our experts for tonight. We have Beth Shaw, and I think she's assisted by Robin Butterworth. Beth, many of you will remember from the fantastic presentation she did for us in South Africa at the General Assembly, which was absolutely fascinating, and we all enjoyed that very much. And I think Beth, you can tell us a little bit more about Robin as well, and about your work. But as far as I'm concerned, you did a fantastic presentation on the ETT technique, the equine transceiver technique, and you are, of course, an expert in biomechanics. And I think you have practices both in South Africa and Hong Kong. That must keep you very busy working with also the Hong Kong Jockey Club, for example, and top level equine athletes. So really, fantastic CV. And thank you so much for your time tonight. And I think I'm going to stop talking now and let you get on with it.
Thank you so much for the intro, and thank you very much for having us tonight. Can we start with the presentation? Okay, is this coming across clearly to everyone?
Yeah, we can see that fine.
Okay,
Looks really good.
perfect. Perfect. Okay, so today we're going to look into Dr. Ian Bidstrup's research on equine birth trauma and link it into some of our new findings on the components of the collagen matrix. This is Robin Butterworth. She works with me here at BSET Academy. And okay, sorry, the dog's in the background. So I'm Beth Shaw, owner and founder of BSET Academy. And as we mentioned earlier, I practice in Hong Kong with the Hong Kong Jockey Club, as well as with the sport horses in Upper China and Chengdu. And then we run a practice here in South Africa and also branching out into Madagascar. So a lot of my practice is with the race horses, but we do support the sport horses in both dressage and show jumping. Robin has been with me for many years at the BSET Academy, and she is the academic facilitator and principal at BSET in South Africa. Here, yeah.
Yeah.
Here's a picture of the academy and me in the field with the students and assistants. So, hold on. Across the equine disciplines, horses present neck issues, and this seems to become a growing concern. Nowadays, we have the ability to X-ray, ultrasound, and discover more about what's actually going on in the mechanics of the neck and the sternum. And in my work with working with the sport horse, I started to do more research and I came across Ian's work, and this changed my perspective of neck trauma quite a bit. And the reason I just wanted to bring forth his information is he has a fantastic website, YouTube videos out there, webinars that share a lot of research and ideas and his history on birth trauma, and I found it fascinating. So that's why I wanted to bring it forth here on this platform and then bring it and compare it with my recent work of locating the components of the collagen matrix and explaining how that tension shifts through the collagen matrix and through the horse. So today we're going to look at some of his research and bring forth what it points out about trauma in the sternum area and the lower neck. And then we're going to introduce the equine concertina, which I started to talk about in October when we were at the assembly. And then tonight I'm going to bring forth some of my findings on hyperextension of the spine and possibly the consequences of the tissues and nerves involved, and then connect that to Bidstrup's work, and then discuss the self-grooming, self-poultice that we mentioned often also at the assembly, and present it to you as if we observe the foals and the dams and their interaction, might it reveal more to us? So we're taking Ian's structural research, and then we're going to look at my observational research in my current work with the collagen matrix, and then we're going to bring it back to the foals and the dams and see if that going forward in the future, if we share this knowledge and we start to watch our foals and dams and their interaction, will we be able to notice how and where their underlying tension is? Okay, so here we go. At birth, the sternum to the withers region is soft, is highly malleable, with the developing collagen matrix providing much of the structural support. These tissues are not fully stabilized. So compressive or abnormal forces during birth and early development may influence how the tension patterns form through the thorax, the neck, the forelimbs, and this raises the question of how much early structural adaptation and distortion may predispose some of these horses to hyperextension patterns later in life. So I'm trying to say that if that horse has been damaged in birth or through the birthing process, what then happens when he's put into high stress going into a fence or high levels of dressage or in the racing? Where if we look at possibly making that collagen matrix, that structure, that scaffolding, that much stronger in their young years, that much more balanced, how much of a better sports horse are we going to have? How much stronger is that constitution of his neck and the neck meeting the thoracic vertebrae? How much stronger can that be if we recognize what's happened at that junction in birth? And that's where Ian's work is just fascinating. Here are some stats, and Robin's going to step in here and go through some of Ian's work. Now, this is all on his website and many articles, and I do list his YouTube webinar, which is about an hour-long great video.
Okay, guys, so we've just picked out some sort of key components from some of the studies that have been done. So in 2003, on 760 foals, it was found that 99%, which was 67 foals, had thoracic trauma at necropsy. Rib fractures were present in 19 foals as a direct cause of death. Ribs 3 to 8 were most commonly affected. 94% of lesions occurred at the costochondral junction, so the junction where the rib meets the sternum, basically. The high incidence of costochondral fractures around T3 to T8 and thoracic asymmetry suggests that birth compression forces may establish long-term restrictions within the thoracic sling. These restrictions may later manifest as girth sensitivity, postural asymmetries, and compensatory spinal loadings in the adult horse. According to research done in 2007, it was found that at least 80% of rib fractures picked up by ultrasound are missed on X-ray. This finding, 5% with fractured ribs as per the 99 papers, translates actually to 20% or 1 in 5 foals with major rib trauma, and not just a rib sternal junction trauma as mentioned before. So during birth, the foal's rib cage, especially at the shoulder and wither, is subjected to significant forces and particularly prone to injury. Rib fractures are not always visible without specific examination, but their presence can significantly impact comfort and performance throughout the horse's life. A large study found that over 20% of foals had rib fractures or disrupted ribbed to breastbone junctions at birth. The 4th to 6th thoracic vertebrae are the most frequently affected, and there are lots of post-mortem studies to support these findings. Right side issues such as right wither and pelvic damage are the most common, leading to problems like difficulty with the right canter, lead, and a dropped hip. This research underscores the importance of careful assessment in neonatal foals and ongoing monitoring for subtle signs of birth-related trauma, as these may influence the horse's behavior, comfort, and rideability for years to come.
Thank you. Don't do any more.
The overview of the research: birth trauma is a major factor in girth, wither, and flank sensitivity, which we see almost daily. Can cause issues which often manifest as fear and anxiety, one-sidedness, sacroiliac imbalances, and saddle fit problems. Can result in discomfort for the horse and dramatically affect rider balance and performance. Critical injuries to the spinal column and rib cage at birth may, or we believe will, have lasting effects on the nervous system.
Okay, so here on the slide, you can see Dr. Bidstrup's website, the YouTube channel. The main thing that he kept repeating in a lot of his research and webinars is that there's no significant lameness, or if horses had rib injuries 2 days later, they're moving fine around the camp with their moms and their mates, and there was nothing that stood out. But as they grew up and then became athletic horses, being ridden, being this and that, more asymmetry showed up. Identifying and treating any birth injuries at an early stage may assist breeders in decreasing potential performance disadvantages. So I found that very interesting. Yeah, and that's another good article there on the right. So this brings us to the equine concertina. Here, through the years of tracking musculoskeletal stress, we started to recognize patterns. And I joined forces with Sarah Weech from Scotland. She's a retired veterinarian and author. And I joined with her in about 2016. So I've taken a lot of my practical work in the stable every day with the equine athlete and reported it back to Sarah for over 10 years, following patterns. And we soon recognized the muscle hubs and inner hub tension lines. So the equine concertina highlights the key components of a bilateral diamond lattice that functions within the larger collagen matrix, providing an intricate architectural framework for force transmission throughout the body. The components of this equine concertina are muscle hubs, inner hub tension lines, 3 balance points of equilibrium, and anchor points. The reason I bring this forth with Ian's work is that if we can start to look at the horse through these components, we might be able to pick up more just by looking at the horse, the mare and the foal together, the foal moving. We might be able to notice where there's underlying stress. So we have here muscle hubs. In this diagram, we've got the muscle hubs, the anchor points along the dorsal aspect and the ventral aspect, and the 3 balance points of equilibrium. You'll see one in the trunk, one in the hindquarter, and one in the neck. The equine concertina as a framework illustrates how tension and force are distributed throughout the body in interconnected diamond patterns. The equine concertina provides a way of viewing the horse integrated tensile system rather than isolated anatomical regions. Developing understanding of this model may help us recognize where a foal or mature horse is harboring trauma, restriction, excess tension within its developing body. So I'll briefly go through these components. Here we have muscle hubs. The muscle hubs are areas where two or more muscles overlap while acting in different directions. Convergent points of tension, and they're capable of adjusting local and systematic tension. And they also are regions where tissues may recruit additional muscles to support locomotion. If the tension is not properly managed through the hub, asymmetry and compensatory patterns can develop. So here we can see with Ian's work, he was talking about hub 3. So that's in the girth region. And then we've got hub 18 in the pectorials there. Sorry. Yeah. And you can see how it transfers down the leg and then is also connected with the neck. So these are muscle hubs. There's 22 muscle hubs on each side of the horse. Okay, and then we have our inner hub tension lines. Inner hub tension lines are diagonal connective pathways that link one muscle hub to another, forming concertina diamond patterns behind equine locomotion. The inner hub tension lines are pathways for transmitting mechanical tension between the main muscle hubs. So as I continue to talk, think about these points and these lines when you think about how a mare and foal communicate, where they interact. This is going to, when you start to look at these components, and see, we're going to show you other examples soon of how when horses get together, they often go to these points, these muscle hubs. And then when they go to these muscle hubs, now you can think about how they're shifting the tension. So go to the next one. These hand drawings here are all during the development of finding the hubs, the inner hub tension lines, starting to make sense of how force transmission is moved throughout the equine athlete. The balance points are areas that of equine equilibrium. So how that horse stays balanced is through 3 points in its body. The crossover points they are the crossover points of inner hub tension lines, creating the primary diamonds of the equine concertina. These points are tangible, visible to the trained eye, and are regions where opposing forces cross over in the horse's body, allowing connective tissue to efficiently transmit force transmission and tension. Sorry. There's a few more words there, but yeah. So these are all Sarah's drawings from about 2022, 21. There's one. Okay, here's our anchor points. So your anchor points they run dorsal and ventral, as I mentioned before. They're fixed locations, and they rest on the skeletal foundation, such as the dorsal spinal processes, pubic bone, sternum, as well as connective structures, including the nuchal and supraspinatus ligaments, the linea alba, and converging muscles of the ventral chest and neck. These structures act as essential reference points for the collagen matrix. So it's where the tension transmits through to the other side. Although considered fixed, anchor points remain adaptable in young horses. They are more fluid until the growth plate ossification occurs. So that anchor point in the forehead, anchor point 8, that only closes later in life. The anchor point under the jaw, the anchor point in the front of the chest, anchor point 4. These only form in our warm blood in our sport horses at the age of 5 or 6. So if we consider it in that manner, those points, those where the bones are only really growing together at much later years. Have I said enough on that one? Here's a image of the equine concertina in motion on a sport horse. Just gives you some insight as to how it does move into different directions. Now we're going to talk a little bit about collagen. And so collagen is the base, the cell, the structure of the collagen matrix. And I'll hand you back over to Robin.
So just briefly through this slide, type 1 collagen forms the backbone of this continuum. The collagen cells grow to form broad sheets of finely laced, dense, supportive tissue known as superficial fascia. Within muscles, the same matrix organizes into fine layers. A delicate sheet called the endomysium wraps each muscle fiber. Bundles of fibers fuse into the perimysium, and finally, the whole muscle is encased in an epimysium, like a sleeve. Together, these layers are all known as the myofascia. Within organs, collagen appears as connective tissue, linking structure and function. Nearly 1/3 of your horse's body is collagen, making it the quiet foundation of strength, flow, and force transmission. Collagen fibers underlie many fascial structures in the locomotor system, remarkably strong and noted for their tensile strength. These fibers withstand high tension. They gather where forces are transmitted through the horse's body, acting as both a protective and supportive scaffolding. Okay, the equine collagen matrix is a continuous body-wide network that transmits tensional force, mechanical energy, and bioelectric charge, supporting the horse's structure and locomotion. Muscle and bone, ligament, tendon, nerve, and blood cells are all embedded within three-dimensional web, which spreads through the whole body, linking parts into one locomotor system. This web conducts vibration, coherence, and force, turning local cellular pulses into whole body flow.
Okay, so now we're going to go from talking about the components of the collagen matrix and what holds the tension together to hyperextension of the equine spine. So bringing this back to our findings, this is when I first started to reach out to Sarah, coming across neck pain, coming across horses that were coming across neck pain, sternum pain. And this is what started my journey on finding the muscle hubs in the components of the collagen matrix. I'll read a piece from Sarah's book. The entire system of back muscles is divided into two major portions. One spans the lumbar and thoracic spine, and the other spans the vertebrae of the neck. They all cross over in the region of the first rib. So now we're back, take a step outside, we're back to Ian's work, the first rib area. When maximum force is applied, the back and neck muscles are capable of hyperextending the spine, usually with severe consequences for the structures at the base of the neck. These structures also involve nerves. Hyperextension is caused by a sudden, sharp, excessive movement. So if jumping out of the starting gates, landing from a fence, which leads to intense force transmission going through the spine and coming to the base of the neck. The nuclear ligament, when this happens, the nuclear ligament may yield at our anchor point 9, which we talked about earlier in the earlier slide. The scalene muscles then begin to work in opposite directions, and the result is stress or displacement on the brachial plexus, the nerve hub of the forequarter. So why I found this interesting is this is a real part of my work, and yet Ian's done all this research on it, and he's saying so much of this trauma happens in birth, and maybe it's not all happening in the training. Maybe it's happening before they even start work. So here you can see me pointing to the area of anchor point 9. It's a bit higher up onto the nuclear ligament. And then these lower pictures here give you a little nook and a dent, and those are both on Muscle Hub 8. Let's go back to my writing here. A theory of hyperextension of the spine in sport horses. It is caused by sudden, sharp excess movement that leads to intense force transmission through the spine, thrusting through T1C7 junction. I wrote it that way because of the force coming through. May also be involving C6. Through my work, I've noticed this may cause the nuclear ligament to yield at AP9. So as I've said, how does this connect with Ian's work? By sharing my own observation alongside Ian's research, I hope to encourage breeders to view foals through the lens of the concertina. So if you consider both his findings and my practical experience and observe your foals with this perspective, together we may uncover new insight that will better support the development of our sport horses. Here is me in the field in China looking at a horse with an undiagnosable four-limb lameness. And then here again, this is anchor point. The picture on the right is anchor point 5 involving the longus coli, again pointing to anchor point 9. And this bottom picture is a nice big old dent at Muscle Hub 8. So here you see longus coli is also affected, especially around anchor point 5. So here I'm finding that the damage at anchor point 4 and 3 disrupts the normal tension patterns and may change how the horse loads the lower limb. Relating this back to Ian's work, foals with sternal trauma often develop an asymmetry pattern around the fourth and fifth rib cartilage, which may lead to compensatory lower limb dysfunction. So the sightings are following each other. Involves key fascia structures, especially the sternopericardium and the diaphragm. Clinical implications, tension shifts at Muscle Hub 4. Muscle Hub 4 is the one back in the abdominals, in the lower part of the trunk. Muscle Hub 4 links directly into anchor point 1, which is at the base of the pelvis. Dysfunction can travel throughout the collagen matrix, even causing disruption to the pericardium. Evidence of active and past hyperextension of the spine has been presented to me through the racehorse, the show jumper, and the dressage horse. This explanation and pattern of hyperextension can be linked and supported by nerve spots and hawk scars, which we discussed at the last assembly. So here's just an example of an imported sport horse. You can see the big tension in his neck, but that's not the cause. The cause of that tension in his neck is from weakness in his sternum and lower neck. You can see him below jumping and using his neck properly. Took a lot of work to get him to that stage. Now, I'm going to now bring in the natural horse well-being, just so this may be a way for breeders and people on the ground to evaluate what's happening with the collagen matrix after birth. And here you can see two foals mutually grooming. What is natural horse well-being? It is self-grooming, self-poultice, and mutual grooming. Behaviors such as self-grooming and mutual grooming may provide early indicators of asymmetry or restriction within the body. By recognizing these patterns, we can begin assessing the integrity of the system from the very beginning. This awareness may support the development of sounder performance horses with a greater longevity for their career. So here I just talk about what self-grooming is. Self-grooming is when your horse uses its own body to maintain comfort, relieve tension, and stimulate sensation. It includes behaviors such as rolling, tail swishing, nibbling, rubbing, licking, chewing movements, yawning, stretching, stamping, pawing, shaking. You have to remember, I spend every single day in the stable with these horses and watch where they move and how they move. So none of it's random. When a horse goes to adjust tension, when a horse goes to his lower leg after you take the saddle off or finish your riding, he's going to do something, adjust tension, improve circulation, stimulation. Here you can see the horses mutually grooming. It's much more than a social act. Although I'm in the stable, those horses join me and through the walls, through the windows, and I've learned so much from watching their mannerism between each other. And then putting the equine concertina on pictures of horses mutually grooming, you can see here, this horse is in the area of muscle hub 1 and a direct stimulation to muscle hub 5, which is then going to the base of the horse's pelvis. So here, although it looks like he's just massaging the horse's back, he's adjusting tension into the other horse's pelvis. And it can also be, let's see, repeated strokes. It's a new way to look at mutual grooming, and this is a new way for you to look at the horses, the foals in the camps with each other, what they're doing. There's a great article here by Sharon Davis, and she did a 24-week study of self-grooming of mares and foals. And here we can see, so what I'm trying to bring to light here is that if we look at the horses through the lens of the concertina, what are they trying to adjust? I mean, here we've got this little foal working through the bottom of his jaw, and we know that that's live and still growing and still coming together. How can we help these horses balance themselves better? Self-poultice. So you might giggle at me here, but none of it's random. I spent my life in these stables, and the Hong Kong Jockey Club stables are very clean. So when these horses strategically plant this manure up against certain parts of their body, it's there for a reason. Are they adjusting compensation? Are they adding heat? Are they adjusting the tension? But it's the same with your mares and with the foals. Where are they always going to roll? Where does that mud packed on? Where are they always itching? The self-poultice is not random, and it's really fun when you start to map it and study it. So here we just put this in as the equine concertina, putting it on a foal. And then the second picture is how some of my students have mapped the self-poultice and the self-grooming. When the horse rolls, when he rolls, where is he always rolling? Where's the mud being packed on? How is he trying to adjust the tension? By identifying these issues early, we can strengthen the integrity of the system, especially through understanding the components of the collagen matrix. From the very start, potentially leading to sounder performance horses. So we encourage you to engage with the equine concertina and map self-grooming and self-poultice, because if you take the time to map your horses, the foals, you might see a consistent pattern. So then you might ask yourself, is that compensation? Is he hurting on that side? But once you can map it and look at it on a routine basis, you might find you will start to identify underlying pain and tension. Clinical developments in equine cervical surgeries, such as these undertaken, I was just at a recent veterinary conference in China with some vets from Equine, and it's really showing that really highlighted the growing recognition of a neck-related pathology in the sport horse. And through my international travels and clinic work, I have observed notable prevalence of cervical dysfunction across a wide range of horses. I found it very beneficial to link into Ian's work. Oh gosh, I'm talking in circles here, but it's good to link into his work and find the research he's done behind it, and understand that there is a lot we can be aware of as foals are developing. So I'm just very grateful for this opportunity to get some of these thoughts out there, and I look forward to chatting to everyone this evening.
Thank you so much, Beth, for and Robin for a really, I mean, very thought-provoking and very far-reaching, actually, overview of your fascinating work. Yeah, I think I would very much like to open the floor to questions from our participants. While people are thinking about it, I've actually got a question for you. I think it's
Okay.
really interesting what you say about observing our foals and also our horses, in their grooming behaviors and in their self-poulticing. I thought that's a really good way of looking at poo stains now. I'm going to have a completely different sort of thought about them now as I'm scrubbing away at my great big grey stallion. But is there something we can do straight after birth to give our foals a bit of a check over to see, what would be the signs of birth trauma that we can maybe look for, very shortly after birth even.
Well, I think at this stage, you guys are very much tied into your vets and observing them on a very clinical stage. But I think one thing to really look at is what the mom does, where she
Okay.
goes, where is she concerned, what are her first reactions, what are the foal's first reactions, what's happening with his muzzle, what's the natural connection. I think
Yeah.
we can learn a lot from that communication. That's what I've learned in my work. The more in tuned I can get to the horse and pay attention to the movements, they're so subtle, but they're there.
Yeah. Yeah. No, I just think that's really, really interesting is because we don't often make that link. We start worrying about our horses when we put a saddle on them, don't we? And then realize certain things don't work the way we expected. So I think this
Yeah.
is where
But
breeders come in. Yeah.
yeah, and I mean, the breeders will know more than I, but I think there's a lot to learn about what the other horse has to say, the mother and the full communication, but
Hmm.
the horses around, they know where that horse isn't vibrating right. They know where the problems are. Even if you have a horse that's routinely getting bitten at the same place, it's because the other horses know his communication's not great there, believe it or
Right.
not.
Yeah, that's interesting. Now, have we got any other questions? People are very welcome. If you don't want to speak, you can also write your questions in the chat.
I have a question because you showed us one slide where there were the indentations on the horses, and is that what we actually call a prophet's thumbprint? And there's the old wives' tale that a prophet's thumbprint is a sign of a good temperament, but it's obviously actually not that at all.
Yeah. So I guess that is one thing to answer Eva's question we could bring into is at birth, if you are seeing dense scars in the hock, that would probably be indicating that the horse has had issues to its sternum or lower neck. But yes, the dents in the neck are most likely results of shifting through the sternum and the lower neck. And
That's really, really fascinating, isn't it? Because yeah, we've as Nadine said, it's always been seen as a positive in a horse, and so we just need to really change our understanding and our thinking, and that's
yeah.
yeah.
Yes,
And then
I
us,
think Anke Twig would like to ask a question. She's welcome to unmute herself and ask away.
Hopefully you guys can hear me. I've not got the best signal because I'm out with the dogs while I'm listening to this. Sorry. I think there was two parts to mine. First was around, and I'm sorry if this was covered in the webinar, but my internet dropped out. The grooming points. Do you think horses prefer certain grooming points like the top of the withers and the back because that's where those anchor points are and that's where they're having the most impact? Do you think that there's a
yes,
link there?
yes,
And then my second point kind of links into that, because there was research, I'm pretty sure it was by Henley in the noughties, that looked at folds and different levels of handling in folds and their voluntary interaction with humans down the line, depending on how heavily they were handled at birth. And they said foals that even if they were held in a cradle hold or guided to the teat, actually showed some reservations towards humans further down the line compared to foals that didn't have that assistance. And they put it down to the fact that the cradle hold kind of puts pressure where predators would go. But looking at the overlays that you put onto the horses now, I'm wondering whether that actually puts pressure onto points that then has adverse and potentially a sort of painful or uncomfortable stimulation to the musculature with the horses. Do you think that could be something?
Yeah.
Does that make sense?
You go ahead.
When they're wrapped.
Yes, yeah.
Yeah, I think you're right there. I definitely think it could work that way round. And I think also with the foals, the handling of the foals. So I think we're seeing so much cervical trauma that's previously, I'm talking the last 10, 15 years, we weren't really diagnosing or looking at the neck as causes of performance issues or lameness. But and we always are sort of, we're looking at the training or what had happened to the horse, but never going back to the birth. And I think it's opened another door for us to go further back, and those sort of birth traumas then predispose sort of cervical issues or thoracic sternal issues, which obviously then there's compensation through the body as far as to say there could be a hand of lameness. But then if we do have birth trauma and then the foals are also handled not well, the neck is very, very vulnerable, especially in that first year, and foals are not always the easiest to handle. There's a lot of things happening to that foal's body in those first sort of 6 months to a year. So I think I haven't really answered your question, but yes, I definitely agree with you. It can go that way round. But that first year of that foal's life, I think, are really, really important in terms of predisposing things further down the line.
Right. I mean, what a fascinating discussion this is turning into. And we have quite a few more questions. In fact, I think I can see 4 more questions, 3 more in the chat, and then we've got Aileen has got her hands up as well. I'm just going to go with one in the chat, and then I'm going to come to you, Aileen, and then I'm going to go back to the chat if that's okay. I think that was roughly the right order. And so Regina would like to know, is there any way we can reduce the risk of birth trauma? Is there something we can do with how we manage foaling or our mares that could, prevent this from occurring?
Yeah, for example, when you're helping a mare that's foaling, many people pull. Possibly that is something that we shouldn't be doing, I guess.
That's what Ian suggests. Ian says you have to be the way I interpret his work was that he's suggesting that more foaling is done outside, and we have to be very careful about assisting. But yeah, what was the original question?
I think also it comes down to selecting the right stallions for the right mares. We seem to be breeding bigger, better foals out of not necessarily the right brood mare. I think it can go right back to selection. Unfortunately, in the sport horse world, that's what we're breeding for. So I think it is going to be a thing that we're going to hopefully learn more about and how to deal with. Yeah, but I think pulling is pulling. I've worked in breeding, but at that stage, it's life or death. Sometimes you've got to get them out.
But we have to remember that it's malleable.
It's malleable, so we can if it's addressed early enough, we can try and manage it. Versus having a traumatic foaling and then just when the foal's up and drinking, we don't look at it again for 6 months. Then rather be a little bit more observant in that phase and see if there is anything we can do at that stage to return the sort of body into balance.
So one thing he goes back quite often in his work is he says that these horses might have massive fractures in the ribs, and in 2 days they're moving completely normal with the herd. It's not producing a head bobbing lameness. That's what's amazing.
Really, really interesting. Yeah, that's really interesting. It's fascinating. Aileen, you're next.
Okay, yeah, no, I'm really enjoying this, and Dr. Bidstrup's research is absolutely fantastic, and I think we just need to get that awareness out there. I suppose my question is for our 2 presenters, like when do you get in there, start working on these foals? How early do you start, and what does because I work with foals as well, and so I'm wondering, what do your sessions look like? I know they're hugely variable. I'm wondering if you're working on your point system to like address the patterns that you're seeing, or how are you working with the foals?
So with SUMCHI, it's the SUMCHI work I do is a magnetic massage with a small handheld tool, and they're designed strokes. So I would just softly uh, I don't know if you can see this, it's not very clean, but softly run through these strokes and the muscle hubs and the anchor points, and see what the tension's like, and just activate it, because the collagen matrix is thinking all the time. And if we connect with these points through the strokes rhythmically, then we can activate the collagen matrix to think and balance itself. So it doesn't need a lot of work, but just touching base. And then what I put forth to the group tonight was that if we look at the concertina, your foals through the lens of the concertina, what will you see? And is there a pattern? And then hopefully we can chat about that again to see what people have picked up. Because I find it's amazing to see what nature puts forth, where the manure is, where the mom communicates, where the other foals communicate. They'll tell us.
Mm.
I think
yeah, I find that the foals, their bodies adapt so quickly. I'll usually start, if there's a problem, at 2 weeks old, and I find that in 2 to 3 sessions, they'll change really quickly.
Yeah, that's fantastic.
Yeah. But I just was interested and curious to know what, like, it sounds like what you're using, because I just use manual craniosacral and myofascial, and so it is manual. And with foals, their nervous systems are just so much more sensitive. So just the whole concept of manual therapy on foals is a challenge in itself at that age. So I'm just interested in your technique with the addressing points, because they can only tolerate so much.
Yes. And so I might just we have a butterfly stroke, and that's just the going up and down the trunk in up and down the intercostals, very rhythmic. And even if I just do that one stroke and a few strokes on the neck, that one time, it's enough. Just to interact and see where the tension's going, how the horse reacts, and then make a decision from there.
Yeah, and it could even be as simple as scratching. I mean, with foals, that's my go-to, to give them a good scratch. And you'll find the spots they want you to scratch. And if you just put that back into the concertina, you actually might start thinking, okay, and then we see where that scratch goes, and then they scratch their leg, and then we'll go and work on the leg. So I know they're not always easy to handle per se, but we can also work with things they love. Just like they would sort of groom themselves or mutual groom with, we kind of can also use those little techniques, so small things that could make a really big difference in the body.
Brilliant. That's brilliant. That's really interesting,
And I would love your feedback, because if you look at put the concertina on, you see that the horse is always going to a certain place. Where is that the compensation, or is that the actual pain? So sometimes the where they're going to is the compensation. So we have to activate the other point.
Mm-hmm. I find that I tend to stay away from the pain, because it just triggers them. So I just have to work around the tissue, Anyway, I don't want to hog the conversation, but
but I love your feedback if you look further into the concertina.
Yeah, maybe I will. But I suppose different things that I think the history taking from anyone who was present at the birth, if a pull had to take place, what was it like? When did the intervention take place? A lot of people will say foals lie down quite a lot when they've had a traumatic birth. That'd be one of the first things that they would say, that he lies down a lot, or contractions occurring that weren't there at birth, but by 2 weeks or 3 weeks old, they're seeing contractions, maybe at the knees, that aren't a tendon contraction.
Yeah.
Or
I think this is fascinating, and it kind of also feeds into Ashley's question, because she said, what treatment options are available to us if we are suspecting these issues? And I think, Ashley, I think we've just heard a lot about treatment options. So I think actually we have covered that question as this conversation evolved. And it's a really, really interesting one, and it's wonderful to actually hear you have this conversation between you. It's great for us to see, such great expertise also in our audience tonight, and to see this conversation evolving. We have a question from Janice, and she asked whether putting a chip into the nuchal ligament causes some sort of damage in a young foal. So I think this is a question about whether chipping could cause problems or not.
Into where is the chip being
It's going
into the nuchal ligament?
Yeah.
I think it depends. Yeah, but where is it going into it?
It goes straight in. They put them in.
But which location?
It's usually on the left side, just near AP9.
Yeah. So what would it cause a weakness in that area of AP9?
Yeah, but I think that's the question. Could it be damaging?
I don't, so it's probably just below where the tension is crossing over. I would think it'd be too thick to be putting it in the nuclear ligament.
Yeah.
They put it in it.
Yeah, I think there's possibly, you could have a little bit of scar tissue formation. I think it's probably negligible to sort of sternal trauma and cervical sort of spinal trauma in terms of future issues. So I know it's a little bit invasive, but I'm not sure I would weight it that heavily in terms of other things we're seeing from sort of trauma in the sort of front of the thoracic cavity and into the lower spine, cervical spine.
Thank you for that.
Because the horse loses its tension throughout the body. When there's a lot of when the nuclear ligament gives way from too much force in the lower part of the neck, there's a whole shift in the tension throughout the body.
Then there was a question whether we could clarify the conversation we had about breeding with the right mare. So I think we made an observation about the fact that some of the styling choices now, to breed for certain types of sport horses could be part of the reason why we see birth trauma.
Yeah, I mean, I'm no real expert in choosing mares and stallions, but from a physical point of view, matching the right size stallion to the right size mare, looking at the mare's pelvis width. I see it in the warm bloods quite a lot. These sort of smaller mares then birthing really big foals, which is obviously leads to obvious issues. So some of the sport horses are just breeding purely on performance, that mare with that stallion, and not taking any of the sort of physiology or the physical aspects into account. And I just think that adds to the sort of occurrence of birthing trauma, because sometimes it's not really thought of.
No, I think
suppose
that's
it's
an
the same as
interesting
us
point.
people with our hips.
Absolutely. I mean, I think it's a really interesting point.
Also,
and what we also consider whether feeding could sort of feed into this. So, we're getting better and better at, feeding our horses more and more. And yeah, would this possibly also have
bigger
an
and bigger
impact then?
foals. Yeah, but I just think we have to, look at Ian's work. There's some great research there. There's some numbers that are a bit shocking, that we do have to notice that foal in the first 2 weeks of his life, what is happening. And I think I just feel that they naturally have a lot to tell us. through these simple movements of self-grooming, mutual grooming, and self-poultice. And if we watch where they're strategically going, it's incredible to watch. It really is. And the little things, the rolling, how they get up. Yeah, I just think if you look at it, I'm excited to hear back from anybody in this group. If they've gone out and they do a 3 to 6 week study and watch where that horse self-grooms, where he applies the dirt when he rolls. Can he roll over? Does he keep reapplying it? Is he trying to adjust something in his chest? Is he trying to adjust something in his wither? When he gets up, does he rub his sternum? You know, there's so much that we can watch. It's like, wow. You don't need a fancy app and you don't need, you can naturally see it.
Well, yeah, I mean, that's really fascinating. Nadine, you've got your hand up as well, but I want to round back out and look at my horses now, actually.
Yeah.
So my question is, because you said about I can understand when with self-grooming, when a horse knows where it needs to go, but with mutual grooming, how does the other horse know where
Well,
to
so
go?
it's the electromagnetic field. So nowadays we know about the piezoelectric properties of the collagen matrix, and that's putting out the the electric magnetic field and how it's vibrating. So that horse next door in a stable that it can't touch, that horse knows exactly what that other horse, how it's vibrating and where it's not right. But yeah, so nowadays the term is piezoelectric properties in electric magnetic field. The
Very
horses can
fascinating.
interpret it through well, when they're mutual grooming, it's through their mouth, their muzzle, their whiskers, their breathing, movements, rhythms. And then mutual grooming, there's a stronger partner. He'll usually is dictating what's going on in the mutual grooming. So same thing going on. The mom knows exactly what's going on with that mare, with the foal, I mean.
Yeah, that is fascinating.
Yeah.
And in fact, we're also fascinated. I think some of you would like to learn more. So we had another question here from Ashley saying, where can we learn more about the concertina theory and the treatments? Yeah, so just basically for people to carry on with their research, carry on with their learning after tonight's webinar.
Yeah, I think that, to go and look at the YouTube that I mentioned about Ian's work, and then for my work, we can share a PDF where you can put together a little journal or a diary, and that's what my student, there's Patreon as well. But just the mutual grooming and or mapping the self-grooming and the self-poultice, you'll have a lot of fun with that. But for us to learn more about my work and SUMCHI socials, my students are saying. But the Patreon, I've got a little book written there about the foundations of SUMCHI work, my SUMCHI technique, and that has a lot of information about self-grooming, self-poultice, yeah, just natural horse well-being. And
Fantastic.
I've learned a lot about natural horse well-being from the third floor, the stable 3 floors up in the middle of a city, because we've been so removed from nature that I've actually forced me to really see the nature of the horse.
That's interesting. Yeah. So are we going to be able to send some stuff out to our webinar attendees, some links maybe and some, as you mentioned, PDFs?
Yes.
That would be brilliant.
Yep.
Because I think people
I'll
would
send
be fascinated.
the observation sheet out. I'll get that finished tomorrow.
That's brilliant. Well, thank you so much. And gosh, I can't believe it. The hour is over. In fact, we're about to run slightly over, but I'm sure everybody will forgive us because it has been fascinating and
Thank you.
a really good discussion. So everybody, if you have any further questions that you would like to post, just email us. I see this very much as an ongoing conversation between us because I think we all got to go and do some observing now, and I think that's yeah. I mean, I find that very exciting. I find that really inspiring, and
Eva, can I say something?
of course.
Next time when we're going to talk about this subject, I would like to have it more on a breeder's perspective. This presentation was more, especially for non-native English speaking people, it was more a lecture for vets than for breeders who have to deal with their mare and their foal during birth, after the first day. I think for our 140,000 breeders, that's much more interesting than all those difficult words for vets.
Thank you.
So we now need to bring it down to earth and go and
Thank you.
No,
apply
we
and
don't.
observe.
It's not down to earth. It's for our breeders.
Yes.
Yeah.
Yes.
Yeah. And I think that's
And
where
there's nothing wrong with this presentation. Listen well, it was perfect, and we
Thank
heard
you.
you in South Africa as well, Beth. So that's nothing. But we have to think about our breeders. How have to
Yeah.
deal? How do they have to deal with their mares and their foals the first day, the first week, and so on? Where do they have to take care of, and so on and so on? That's for our
Yeah.
breeders very, very, very important. And
Yeah,
I think the next
if I
time
could,
we should talk about this.
okay, if I can say anything on that is, I would really like to hear back from the breeders, the mare's reactions in those first 2 weeks. If now that I've mentioned the collagen matrix, the concertina, the points, the muscle hubs, the anchor points, where is the mare going most often?
Mhm.
Is there a relationship between Ian's work and how the mare looks after the foal in the first 2 weeks? Can we draw some kind of connection between he's done massive research on rib trauma and it's there and he's saying it's there in a high percentage of birthing issues. So my question is that if people can take a little bit of the work that I've just said about the muscle hubs and the anchor points, where is that mare going? Can we learn from her more about the foaling and how we can support the foal afterwards? I would love to hear that back from the breeders because if we
Yeah.
can combine that information, we might learn something new or a new way to help.
So
Yes.
it's basically we need to observe more to learn more and to make the connections is what I'm hearing.
If my work that Sarah and I have done to find these muscle hubs and anchor points and mentioning the inner hub tension lines, if that can now be put into your hands and say, okay, now breeders, please watch the mares with this lens on, what can we learn?
So I think what I'm hearing loud and clear, and it's also coming through in the chat, is that we see this as a start of an ongoing conversation and that we would like to do some follow-up webinars and maybe share some more observations as well. So I think that would be a really good thing. So
That'd be
you
great.
have, I think we're at the start here of something.
And I think it's also just an awareness. So when you're foaling or you are the person foaling and you're pulling a foal, that you are aware that you are pulling on those first 5 thoracic vertebrae when you are pulling those legs. And I've pulled many foals myself, not knowing what I know now, that you just kind of want to get the foal out. And then there's not much awareness as to how or the type of tension that you're pulling, jerking versus slow. And the other thing, some I know protocol in some studies is that all foals are assisted out. So I think that's one of the most natural things that we can do. And if it is not life-threatening to the mare or foal, they should, for the most part, be left. That foal might need time for its body to adjust to come through the birthing canal, but the person foaling is in a rush and they want the foal out and standing and drinking, so it gets assisted out really quickly. So I think also there's just that awareness of from a different perspective when the mares
Yeah.
are foaling.
Yeah.
My
Yeah.
two cents.
And so like, and watching like as the skull's closing and how much does the mom interact there? And if I can at least mention and say, okay, anchor point 9 is a key point to the bounce of the hindquarter. If we see the mares going to anchor point, if now, even if I've only made 3 people interested and it's 3 more people that are going to see, is that mare going to that section of the neck? Is the foal going to that section with its hind foot? Is he trying to activate it? So we might learn that, yes, he did have trauma during birth, and this is how he's adjusting it. But if we can do more to help him adjust it, then he's going to balance his neck and forequarter better, and hopefully then have better forelegs.
Great. Yeah. Yeah. So this is something for us to take away right now.
Good.
The other thing to take away is, guys, we need to start observing. We're going to send you the PDFs of the sheets that you can use for your observations.
Yeah.
And then maybe what we should do next is actually organize a webinar for us all to share. And that could be really
That'd be
interesting.
great. Thank you.
Yeah.
I'll get you
Yeah.
those sheets, and then I'll also be able to provide a journal that we've made, and that has places where you can observe how they roll, etc.
Great.
Because that tells you a lot about how they're adjusting their own tension.
Well, thank you so very much. Thank you also to Andres, my fellow board member who was here tonight. Of course, a big thank you to Nadine, as always, for your hard work, Nadine, in making these things happen and in keeping us all going and organized. And thank you so much to Robin and Beth. What a fantastic talk and what a great discussion as well. A big thank you to everyone who's been here tonight, who has contributed with their questions and who has listened, and who is hopefully going to go out and do some fantastic work now observing their mares and foals.
Thank you so much.
Thanks,
Thank
guys.
you.
Thank
Thank
you.
you, everybody.
See you.
Thank you.
Bye-bye.
Thank you. Bye. Bye.
Bye.